My name is Dr. Samuel Messieh, and I'm a board-certified orthopedic surgeon in both Canada and the United States, and I subspecialize in hip and knee replacement surgery. I am medical director of the Joint Replacement Program at Winter Haven Hospital. I've been practicing in Central Florida since 1991, and I've also been a member of the Hip and Knee Association for the last decade and a half. Bilateral knee replacement refers to knee replacements that are done on the patient on both sides. They can be done either simultaneous or they can be done in a staged fashion at different hospitalizations with different anesthetics. My most common indication for simultaneous bilateral knee replacement is severe deformities. This would be a patient either with a severe bow legs or severe knock knees. What we're referring to today is simultaneous bilateral knee replacements in a patient that had severe deformities and both his knees were replaced in the same hospital setting under the same anesthetic.
My name is Ed Guspett. We're from Port Washington, Ohio, and 2.5, 3 months in Florida we spend at Haines City. Back home, we're spread apart. I ride a bicycle from barn to barn or house to barn, and I noticed, my knees didn't bend like they used to, so I probably didn't get even 90 degree bend, or they didn't straighten to zero either. The pain got to where most people wouldn't have put up with it. Worse every year. Just shouldn't have waited so long to have them done.
Ed had severe deformities of both his knees. He was severely bow-legged, and in our eyes, he was a good candidate to proceed with bilateral knee replacement. The major advantages of simultaneous bilateral knee replacement is one hospitalization, one surgery, one anesthetic, one course of rehab. This has a psychological and social benefit. We should be able to return the patient back to work earlier with less time down from their workplace. He was enthused about this and felt prepared for the rehab involved with this.
It was a 7 o'clock in the morning operation. I was up walking the halls the same day with a walker.
On the afternoon, same day as the surgery, the physical therapists assess the patients. They apply knee immobilizers to help the patient stabilize their knee during their first few steps, and they get the patient up and walking that same day.
Well, it couldn't have been much better either, I guess. That's my first experience. I've been the luckiest guy alive. I done some shuffleboard 2 weeks after the operation, pitched horseshoe 3 weeks after the operation. I had no pain, and I just tried to ease into it one game at a time just to see if I'd have pain or what, and it all worked out. I get made fun of, you probably noticed pitching horseshoe. Everybody has a hook 1.5 feet long, and they pick the shoe up, and they always laughed at me. I always bent over. I didn't need that 1.5 feet, even with my bad knees. I never, ever, one day, ever used that hook to pick the horseshoe up. I always told them the hook is for old people. Never a day goes by that they don't brag about the difference and how I walk different and all, and that makes me that more ashamed that I didn't have something done sooner.
Talking to Ed on his post-operative follow-up, he's really quite happy with significant pain relief and restoration of his function. His legs are now well aligned and they're straight again, and he's a little taller and a little happier.
I have nothing bad to say. Nothing bad to say about any of the people, the hospital, anything about it. It was a pleasant experience. I would recommend Dr. Messieh to anybody. I think he's an excellent doctor.